You mentioned that the healthcare plan is not perfect. What would you do to make it perfect?
Well, one of the things I adamantly opposed, even going back to the '08 campaign, and one of the reasons I argued with people and with friends, family, and other strangers on the street was that John McCain would finance it by taxing our health insurance benefits for those who are lucky enough to have health insurance. And Barack Obama said, no, we won't. That's not fair. That's not the right way to do it. There was no one more disappointed or discouraged or downright angry than I was when he accepted a bill that allows the government to tax those of us who are lucky enough to have it. I think it's unfair. We've got to find a different funding formula. And if that means that the mega rich have to pay a little more to do it, then we need to look at that. If you look at the kind of tax structures we've had in the Bush era, we have an entire segment, albeit it's a small one in percentage, not two, and I would argue the top 1% has really had a free ride. They have accumulated more wealth over that time. They have not been hurt. No matter what any Republican will go on the House floor and say, the rich were not the ones that felt the pain of this recession the most. That's a big one. We're going to find a way to fund it other than taxing people. They say Cadillac plan, but when you start seeing the actual numbers, if you have even a decent Blue Cross Blue Shield plan, or if you happen to be in a union household, for 20 years you were told, oh, we can't give you a pay raise, we'll just give you better medical benefits. Well, now, sucker, you're going to pay taxes on that. You didn't get the raise either. We've got to find something. I'm not a big fan of the individual mandate, because the individual mandate without some sort of non-private option, I won't say public option because that means something different to everybody who hears it. But if people can't afford it, and I know it's supposed to have a sliding scale based on income, but we always know when we get into that business, somebody in there is going to get lost. The money that the subsidy they're supposedly going to get is not going to be enough to actually provide them with good health insurance. And yet if they don't, they are going to be penalized in the form of a tax for not having it. So I don't like the individual mandate either. Now, as far as a public option, I don't support a standalone public option. And by that I mean, I don't think it would be cost effective to create from scratch an entirely new apparatus with all the new people to hire, a whole new system to try to figure out. But we may very soon, in the next 5 to 10 years, find that we're not containing costs well enough, and that the individual mandate's cruelty to people who can't afford insurance has bitten hard enough in our people that we need to examine the concept of Medicare for all, where, depending on your income, you will actually pay a premium. Nobody will be giving you health care. It's not socialized. You don't get to just go in and get free health care. But your premiums will be set to where you can afford it. You'll pay a premium, but you will then be in a healthcare system where you can get, your outpatient doctor visits, your hospitalization, and your prescription drugs. We're going to have to look at it, because in the end, that's really the only thing that's going to, and I know you love this term, they bandied about during the whole debate, was bend the cost curve back. And in the end, that's what we have to do, because we don't contain health costs. Nothing we've done is going to really work. But it's a start. There's some really good stuff in there. I think a lot of people are going to start seeing it very soon. Some people already have, particularly people who have small children who are very ill, and now get their children covered.